MINDBEND, non-ordinary and extraordinary states of consciousness for MINDBEND Creative.
My guest today is Hilary Sparrow from the Denver Psychotherapy Group. That's your practice that you founded in Denver, Colorado.
Yes. Good morning.
Yeah, good morning. Congratulations on making it to the MINDBEND podcast. This has been in the works for a while,
Yes.
and it's nice to finally have you out here. We met at the MAPS conference in Denver. That was in
Yes.
June, right?
It was in June.
Yeah, and you were you were part of a morning seminar with
Yes.
colleagues of ours, Matt Zeman and Molly Malouf.
I was. Yes. We gave a workshop on sex therapy and ketamine for peak performance.
And as a psychotherapist, you specialize also in ketamine-assisted psychotherapy.
I do. Yes.
So talk to us about what it's like to be a psychotherapist that specializes in ketamine-assisted psychotherapy. Because one of the ways that people are becoming familiar with ketamine is through ketamine-assisted psychotherapy, and that process can vary from practice to practice, right? It can vary from practitioner to practitioner. So how did you first come to this idea of incorporating it? Because you had a psychotherapy practice, and you studied it before you even thought about integrating ketamine into the practice, correct?
Yes.
So what did life look like before ketamine became a part of your practice? What did your practice entail?
Yes. That's a good question. So I specialize in somatic psychotherapy and treating anxiety, stress, and trauma. And somatic psychotherapy basically means that we incorporate the body, and we incorporate some talk therapy, but I ask clients a lot, what are you noticing in your body, and where do you feel either your stress, anxiety, or trauma presenting in the body? And so I built my practice to specialize in somatic psychotherapy and the treatment of anxiety and post-traumatic stress. And then somewhere along the way, I realized that there are certain tools that can improve treatment efficacy with different types of clients and can move the client through trauma resolution more quickly and more efficiently. And then about 5 years ago, I started getting familiar with ketamine-assisted psychotherapy, and I advertised myself and my practice as a psychotherapy practice to treat and resolve trauma, and also to awaken and inspire goals within clients. And then the methods or the ketamine therapy is a modality we use to get to that goal. And so I'm a little bit different in that I use low-dose troches, and a troche is a clinical term for a lozenge.
Mm-hmm.
And I keep it intentionally low because I want the client to still have contact with their body. I don't K-hole clients or do traditional IM or IV doses because I still want the client to have connection with themselves and their body and still be able to talk to me. We just loosen up some of the anxieties, and we open up some defenses, or we eradicate some defenses, and we open up more of the healing essence in the client. And we do that through that low dose ketamine protocol.
You're facilitating a state of being more disarmed or
Yes.
a little bit at ease.
Yes.
Okay, so it's not that the ketamine is being put into somebody and that's necessarily creating the change. It's facilitating a mentality that can be open to the guidance of a psychotherapist.
Yes. I call it an emotional lubricant. We just lighten things up, and I usually require 5 sessions. With me, we engage in some rapport building, so getting comfortable with one another. And then also, I like clients to have an awareness of their body and be able to regulate and diffuse episodes of panic and anxiety before we introduce the ketamine. And so usually at about session 5, if the clients are still open, then we'll introduce that type of therapy. And for the clients I use it with, it really rapidly creates this window of time where they can establish a new relationship with their trauma. And sometimes clients can see the moment that their traumatic event happens through it with a new lens. They can view it with enhanced compassion and understanding. And then they also develop new ways of viewing themselves without the constant maladaptive narratives or self-defeating thoughts surrounding that trauma. So it creates this window of time where the client can really see themselves through a new light and anchor into their strengths and their really who they are outside of their trauma. And they can step into what they want their life to look like, being more open and more compassionate and more curious. And that actually lays the groundwork for the continued behavioral practices and mindset shifts that then allow the client to really step into their whole authentic selves.
So there's a significant amount of work that's put forth before introducing the ketamine components is even considered.
Yes.
Yeah. And that's how you operate your practice specifically.
Yes.
Yeah. Because I know that's not like that for everyone. Like my experience with ketamine assisted psychotherapy was not an experience that I would necessarily recommend to anybody else. It wasn't a positive experience. There was no what I would consider psychotherapy involved. It was taking a trochee, laying down on a couch with a blindfold, being blasted with a bunch of bad techno music, and sort of being left to my own devices. And then at the end of 3.5 hours of spitting into a bag after drooling a whole bunch and waiting to be transported to another dimension, the therapist asked me if I was back, and I was like, yeah, never really left, and whether that's, I expected there to be a component to the session that felt more like traditional therapy, but this was literally a service. It was like pulling in to have your oil changed. And it was there was one facet to the offering, we had a very brief intake session where I just kind of pontificated on whatever I thought my problems were or what I wanted to work through, and then fill out a little bit of paperwork, do the medical stuff ahead of time to get approved for the prescription, pick up the prescription of the trochee on my own, and then go in and take it while they sat in the corner and I laid on the couch and whatever was supposed to happen would happen. But there was no, it was just an a la carte offering, like I would have imagined something a little bit more comprehensive. How did you learn what your approach was going to be? Obviously, every patient you have is different and they all warrant some kind of different approach. But how did you determine what your protocol was going to be with introducing ketamine specifically?
That's a really good question. So over the years, I've actually become more, I guess, less rigid and more patient specific with the protocols. And the reason is because ketamine impacts every single client differently. And sometimes you need one session and the client is good, and sometimes it requires a sequence of sessions. But what I believe my practice and my specialty to be in psychotherapy, and ketamine is just an additive, adjunctive piece. And so I incorporate it into the work that the clients are already doing with me. And it's important for me to get a clear understanding of who they are as a person, what motivates them, why they chose now to seek out therapy, what a supportive therapeutic relationship looks like, what metrics of success we use to determine growth. And I also like to get an understanding of why the client is interested in ketamine. And I personally think the decision to add ketamine or any sort of alternative therapy is a very personal decision, and something that the client obviously has to consent to. And so I just decided after comparing traditional psychotherapy with psychotherapy with an additive, adjunctive psychopharmaceutical like ketamine, it really could, for the types of patients I use, it really gets them to their goals faster and more efficiently. And I think the reason it's multifaceted, but I think there's a robust antidepressant property with what happens when you ingest the medicine. There's a glutamate receptor impact to the brain that's very neuroprotective. And I like to describe it to my clients that the ketamine really easily kind of and very beautifully disrupts the neurochemical patterning associated with their anxiety or their depression, no matter what that looks like. And a lot of times it's a subconscious thought that'll come up that we're not even consciously aware of, that'll creep up, and it's in our subconscious, and it will be something like, I'm a failure, I'm not enough, oh, I did it again, this anxiety, I can't shake it, something like that. And so what we do is we kind of create a space where it's called the default mode network, where the constructs of self and the default mode network kind of shuts down, and it's similar to a flow state where all those thoughts are quieted, and something happens in the brain where the brain actually becomes more malleable and more neuroplastic, and those bad habits and self-defeating thoughts that are so deeply entrenched into the different neural pathways, they become less rigid, and they become more buoyant, and they become more flexible. And so our clients are able to do whatever they want with that space. So you basically get a clean slate, and you can pattern interrupt, and then it's up to them what they want to do with that. And sometimes that's a whole question of identity, is if you've been so identified with your anxiety or your depression or this one way of being, and then all of a sudden you have a very, very powerful way to step out of that can come with a lot of changes too. What does it look like to step fully into your power or your purpose and completely leave some of the negative thought patterning behind? So I'm one of those therapists I never thought that I would be, but now I'm a fierce advocate for ketamine therapy because it's almost doing a disservice not to use it. And I've taken a lot of trainings on it, and I do it the right way, and I have a prescriber in-house, and a lot of my clients specifically come to me because they're wanting something different, and it does give them something different, and it is very powerful. There's a reverence to the medication, I think, too, because it is very powerful. We want to make sure that we're just understanding that. But the more I get to know this medicine and this protocol, the more I think it kind of speaks for itself, and I'm just the vehicle or the vessel that it chose to use.
Mm-hmm. When people contact you, Denver Psychotherapy Group, through your website or a referral from another physician, are you able to give a percentage of how many people are inquiring specifically about ketamine at that initial point of contact? Do you think you have an idea of how many people bring that up, or can you say it's a majority of people bring that up, or a minority
No,
of
it's
people?
maybe 20%.
Okay.
And the reason is, I think, is that I'm a little bit different in that I'm not a ketamine facility, and I don't I'm more advertised as psychotherapy versus a ketamine practice, and so it's a little more subtle.
Yeah.
And I also operate primarily off of referrals from different physicians in the Denver network, and I do that because it's important for me to have collaboration, because ketamine therapy is so different, and I really like to be able to contact the patient's primary care physician or one of their other nurse practitioners or therapists, and really have that collaboration to help the patient get the most out of those sessions.
So that's a big part of the majority of work you do, is collaboration with other physicians about the person that you're seeing.
Mm-hmm.
Okay. And are most people coming to you on insurance? Is that how they're getting services?
No, ketamine's so new right now. I see clients cash pay.
Mm-hmm. Got it. What does your advocacy look like within the community? You said you're a fierce advocate now. Like, what does that actually entail? Where are you advocating? Like, who are you having discussions with about this? Are you advocating to your patients? Are you advocating to peers? What does that advocacy look like for you?
Yeah. So I always try to advocate with patients. I'm a part of a consultation group in Denver with ketamine professionals. And I think that's so important to stay connected and have clinical discussions to talk about caseload and best practices with other practitioners. So we have a monthly group, and I'm pretty involved in that. And then recently, I've started sponsoring continuing education courses to educate both clients and therapists on how to build out a ketamine protocol into your practice. Because one of my callings in life is helping the healers or healing our healers. So working with other therapists or doctors or people that really take care of us, because there are certain challenges that are unique with being a provider that I've been gifted enough to understand and also be able to help people through. And so I really enjoy being able to provide different courses or workshops on how to build a practice for someone maybe just starting. One of my other areas of interest is working with the entrepreneurial community and with those who identify as women, because I think that's a very unique position to be in too. An example is myself. I think I'm in a very small position of women in Denver who has a practice, is an entrepreneur, and is a provider. And it's an adventure, I think, in a lot of ways, running the ship and owning my own company. And then there's also a lot of challenges. Mm-hmm. I think what you and I have talked about, sometimes it gets a little lonely, and sometimes there's a tiny hint of stubbornness of that I think every entrepreneur has, with kind of wanting to do things by ourselves. And so I really like to use the skills that I've developed to further the entrepreneur community, and really also work with peak performers and using these therapies to optimize what we already have and make what we have better, and create optimization around flow states and productivity and people that perform at a high level. For example, professional athletes, a lot of them are starting to incorporate different brain health procedures or practices into their overall training protocols, which I think is fantastic. And so it's just important, or I like to be able to use the things that I've learned to really progress our industry at a state level, at the legislative level, and then also to help support the entrepreneurial community as well.
You were commenting about the support system that's actually in place for the providers themselves, healing the healers or working with healers to I guess incorporate modalities that help with their own wellness. It's something that's always fascinated me. The brain space, the mind space, the spirit space. The tag for the show is MindBEND: Non-Ordinary and Extraordinary States of Consciousness. And to me, generally speaking, it feels like a pretty extraordinary state of consciousness to be in the presence of another person's consciousness, psyche, life experience. It feels, from my vantage, I haven't gone through any of the training or any of the discipline or any of the education, but it feels like an adventure. It feels like it would be an adventure, a wild ride to be around so many different psyches coming at you all the time. So to the point of healing the healers, can you just tell us a little bit about what it's like in your experience to always be on the receiving? I don't get to ask psychotherapists this very often, so I'll take advantage of the opportunity, if I may, and ask, how do you regulate for yourself what it's like to be there when everyone's coming at you with some of the most challenging parts of their lives, some of the most trying or painful, or what's it like to be in that chair or on the other side of the camera or where you are with these people? Like, it's fascinating to me. And you see multiple clients a day on a busy week or a busy day. What's it like to kind of keep up the routine, client after client? How do psychotherapists or peers of yours, how how do they work? How does it work for you? How do you sustain the practice?
That's a good question. I think what we learned in school is a great metaphor is that you kind of, once you get into the clinic or once you get into work, you take all of your stuff, my own stuff metaphorically, and I put it in a bag and I leave it outside of the door because that's not my time. And then, it's called a container technique. I do really well with metaphors, and I like the idea of, okay, now's the time to work, and my job is to be present with this person in front of me. So any of my stuff, I'm just going to leave it out here, and then so that I can be present for my clients. And I think it's one of the biggest honors to work in the field that I work. And I built my clinical experience working with a very, very traumatized population. And I did my practicum experience at the VA and worked with a lot of combat veterans with blast wave injuries, brain injuries, and PTSD. And I think it's a big honor to be able to be on the receiving end of somebody telling you something they've never told anyone before, or bringing light an area of darkness. And I think there's a science to it too, the science of healing and health and incorporating the protocols. But I think what people want and what people need is just someone on the receiving end that cares and that will listen. And I think that can be a huge instigator of change for the clients. And I think provider burnout is becoming something that's getting talked about more. I think after the pandemic, we started to see really high levels of provider burnout and turnover. And I think it's good to understand that providers and healers, we're not superhumans. We think we are, but we're not. And so I think it's great. One of the piece of advice I got to help manage that is taking regular time off, or having maybe a staycation every quarter, or taking a short trip, engaging in self-care practices, and really understanding how the caseload is impacting you, and being able to add where you need to add and then take away where you need to take away. And also just connecting, you and I talked about it before, connecting to joy and and prioritizing that too as a provider, because I notice, and I think if I were a client, I would want a therapist who, rather than a therapist that's burned out and kind of burning the candle at both ends, which sometimes happens, and I'm sure at the ER and hospitals, that's just what happens. But I would rather have a practitioner who is present and engaged and full of joy and inspiring, because that's really healing too. That just being around someone's energy that is uplifting, and that you can feel the level of vibration and optimism and just assurance of themselves, that's contagious too.
It's a tremendous amount of energy to need to keep up, though. That burnout idea did come to my mind and other people's minds, I think, more, like you said, after the pandemic, and first responders and people who are working in clinics that had to stay open. But you have identified some techniques that you use to keep your energy, to exhibit self-care. It's a fascinating space. What's it been like to be a woman entrepreneur in Denver in this space? Have you had the support of peers? Has the community been open? Are there particular challenges that you could address now in a way that you haven't before? Like, what's that been like for you, and where could it be better?
Yeah, I think for me, it's been something that I've had to be intentional to seek out other resources or relationships with other entrepreneurs. And I found some of them. There's a lot of female networking groups or different types of opportunities to meet with like-minded people. And I think that's huge, to just be able to talk with someone who's in a similar position, who's self-supporting or self-creating most of their income, and who has a company or multiple companies, to just have the support and have other people who are on that same path, and specifically women or women identified people. That's it's nourishing, and it's really supportive and additive. And I've got great friends who and those networking groups, and where we can just kind of have an open dialogue about things, just challenges, or feeling frustrated after pulling a near all-nighter to just get the work done, which is not great, but sometimes those 1 a.m. nights happen more than we'd like to admit. And then I think just having fun and being reminded why we do the things we do, because I think that I'm in such an interesting position, and that I've built this life for myself, and there's a tiny bit of stubbornness in there because I like the freedom that comes with it too, and the autonomy and being able to kind of call my own shots. And now I am spoiled with my schedule and the type of work I do that to do anything else would seem like a stretch. Yeah. But I think it's important to do that, and then to connect to joy, and then even little things. I've realized, like, creating a community around the things you love. I think I'm an avid Zumba gal, and I love the gym, and I love making fresh juice, and just knowing what things are lifelines to me, and then inviting people into those times too, and creating community from there is so important. And it doesn't matter if it seems weird, because I would get self-conscious about things sometimes, like, oh, am I dancing too much, or was I twerking too loud in that class? But you just have to do what makes you happy, and just trust that it's great. And I think the more we can learn ourselves as entrepreneurs or providers and really be honest with that, we can figure out what brings us back to center. And those techniques or those practices might seem odd or even overly simple, but figuring out what you need to bring you back to center and to bring you back to going on or having one more client or having one more day. And a big one for me is quieting down and making dinners. I love just going to Sprouts or Whole Foods and getting a piece of fish, and then just being so mindful about chopping the vegetables and creating all the flavors and making a glaze and making a marinade and working on that for a couple of hours, and then sitting down to actually eat. That's something that doesn't get talked about very often, is providers with nutrition. Because there's times too where you'll be in the clinic for 12 hours and you eat maybe a handful of peanuts and then a Gatorade and call it good. Just because that's just what happens. But I think prioritizing the nutritional aspect too.
Absolutely. I know there's been a transition for your practice into more online consultation, more online therapy services provided. Is the ketamine-assisted psychotherapy happening online as well?
I think a lot of companies are going in that direction. I keep my ketamine sessions to in-person only. And it's only because too, I do a lot of the somatic work, which is harder to complete over telehealth. So my specific protocols are only in person right now for the ketamine therapy, but I do know there are some companies that are getting into the telehealth space with ketamine to open access or increase access, and even to just increase awareness to how ketamine can help with psychiatric conditions, which I think is great. But for the way that I use it, I think it's best done in clinic, in person.
Revisit that term somatic for me too. Somatic means body.
Mm-hmm. Yep. So somatic is body-based, and it's basically a session where we don't talk a lot, and that can drive some clients mad, especially the highly cognitive people. And so it's really a practice in connecting with your body and recognizing where different emotions live in the body and how you might be holding on to them, and then what things help you to release them. And I think for so many of us, we live from the neck up, so we're only in our cognitive minds, and we're really good at doing that, especially us therapists. We intellectualize things, and we like to be in this cognitive realm, and it helps us understand things, but sometimes we get so disconnected from what we're truly experiencing, and there's a physician by the name of Gabor Mate, and he wrote a book called The Body Says No. And I use his work in a lot of the work for my clients, and I assign him as reading to help my clients better understand their condition. But the premise is that when we can't say no with our mouths, or when we've learned that saying no is unacceptable, or we either get chastised or abused, or we just like saying yes, but we can't, our body absorbs that, and it manifests as chronic illness, depression, anxiety, autoimmune, all sorts of things. And so his theory is that if you get to the root and teach yourself kind of how to advocate for yourself and say yes more with your mouth and with your words and with your actions, then your body doesn't have to absorb the stress from all of the people pleasing and all of the ways that you deny what's going on in your body. And some of it is so subconscious because some of it's learned, and it's childhood coping strategies, and we just learn to kind of disconnect. And to some degree it's helpful, but it can also intensify and exacerbate some health conditions as well.
We met at the MAPS Psychedelic Science Conference, which took place in Denver. And when you discuss things that are psychedelic with your peers, or when you contemplate the notion yourself, I like to ask guests, what does that term mean to you? I mean, we know what the definition in the dictionary might allude to, but when you think of psychedelic, what do you think of? What comes to mind? Is there a process? Is there a phenomenon? Is there an experience that comes to mind for you? Is it universal? Does it change depending on the situation? What do you think about the term psychedelic?
Psychedelic, I think what immediately comes to mind is mind expanding, because I think there are certain things that can help us to expand the realms of our normal mind and our normal consciousness and our normal awareness. And there's a photo I have in my office that one of my first ketamine clients gave me, and it's a picture of a head with flowers blooming out of the brain, or the posterior region of the brain. And that image also captures how psychedelic therapy can create blossoming within ourselves and within the brain. And I think there's sometimes psychedelic gets mixed with the war on drugs and some of the illegal substances, which is unfortunate. And for my practice, and that's why I kind of tend to focus on just ketamine specific psychotherapy, since those are the legal options right now in Denver. And I think Denver is very progressive. Boulder is very progressive with the psilocybin and the MDMA for PTSD. And I think it's also something that happens. I think it gives us insight that we need, not necessarily that we want. But there's this phrase that in the psychedelic therapy communities, that once you see things, you can't unsee them. So with psychotherapy, or sometimes with blockages, or we might feel stuck in some ways, there's a reason usually. We're not typically just stuck. We can usually figure out a reason and then get unstuck. And I think psychedelic therapy and ketamine can really beautifully create this enhanced level of consciousness where you can see things from a new perspective, see things that might be helping you and see things that are hurting you, and give you what you need to resolve that, or to take steps to create the best outcome that you need.
With due respect to the anonymity of your clients, can you perhaps share an anecdote of an experience where the ketamine-assisted psychotherapy specifically was utilized to break new ground with a client who had a specific need and benefited directly from this tool, and maybe illustrate some of what that process was like, how they expressed their own experience of the takeaway?
Yeah, I think I'm going through people in my head. I think one example is I think it really can help with stuck processing, and some of my highest functioning clients who might be juggling multiple things at once. They have a lot going on, and they can get stuck in their minds or the rumination. And I had one client who was also a therapist and was struggling with their specific patient population and struggling with self-care. And they had some traumas in their past. And I think what the ketamine did that the traditional somatic or trauma therapies took longer was it isolated the moment of time that the self-defeating thoughts happened. Their parent kind of lost one of their like comfort items on a family trip, and then their parent yelled at them. And so it kind of, and usually that when there's a trauma event or an event where we experience such intense shame and fear and feel so bad about ourselves, we dissociate, or it could because that the trauma is so immense. But what the ketamine did was it just highlighted that initial moment of when those thoughts started, so that the client, so we could both really go back on that and say, wow, because it's so interesting because that client, they said, oh, that's the exact moment when I learned to doubt myself, was when I lost this my special stuffed animal thing on my family vacation, and then my parents yelled at me. And then
the client found that moment themselves under that treatment protocol in that space where they hadn't before. It came up. Were they in like a meditative process in order to find that moment, or had it been repressed before? Or so you feel like the addition of the ketamine protocol enabled their thinking to open up, to soften, so that they could get in and address a particular moment that needed the attention in the therapeutic setting.
And to resolve it.
Yeah, which is your stewardship, which helps you
Yes.
to resolve the moment. Yeah, yeah. I think that's a very succinct and helpful anecdote, because we talk about these things, and the nitty gritty of it, you don't really feel until you're actually in the moment. You see it time and time again. Yeah.
And so often we develop armoring around the things that hurt us. And which is understandable because it's how we learn to survive. I mean, it's just what happens. Something happens that we can't prepare for, that rocks our world, either that's intentional or not intentional. And we have to adjust and adapt. And from my perspective, if we can find the source of the blockage or what's creating all the distress, and if we can go in and resolve it, once we find the root, it's all smooth sailing from there. And there's a poet, Rupi Kaur, who I've quoted to you before, and she says, you find the root and then you kiss it all the way up. And so you find the root, or you find the moment, or you find whatever happened, and then you develop a new relationship with it, and you view it from a lens of compassion and understanding. And sometimes it's a childhood version of themselves, and so we'll ask, well, what would you say to that version of you? What would this version of you now say to that version of you then? What did you need to hear? Did you need to hear that you were safe and you were seen, and that I love you and that it's okay, or that you're going to get through this, or oh my gosh, that's crazy, you got this? And so we actually create resolution rather than kind of waiting for resolution to happen. We actively figure out kind of where the distress is coming from, what the root is, and then it's almost like we inject so much love and compassion and understanding and a big hug around that area. And then that's when the therapeutic work starts happening to create the new thought patterns to step out of that, because we don't realize it, but sometimes we reinforce some of the things that keep us stuck, but we don't even realize it. It's the subconscious narratives, and we have this narrative in our heads that says, oh, I can't get past this, and I'm so stuck. And so then once we kind of figure that out, then it's the thought patterns and the behavioral patterns that can reinforce the desired change.
Yeah, and that's why it helps to have a trained professional like yourself
Yes.
to help illuminate all that.
Mm-hmm.
To conclude, I know that more people now probably have an understanding of psychotherapy, of counseling in general. I know that I hear advertising for it in places I never would have heard 10 years ago. Companies who are offering online therapy or online counseling, coaching, whatever it is. To this audience, anyone who happens upon this podcast and has been considering psychotherapy or some kind of counseling in general, or there's something eating at them they feel like they could benefit, what might you say to somebody who is reticent to enter that space, or has anxieties, or is fearful for whatever reason? If you could just take a moment to say, what might you tell them to help ease their mind when considering finding a care provider of this nature?
I would tell them that hesitancy and fear is normal. Almost every client that I've had, not every, a good portion of clients that I've had have told me that the scariest thing in their life that they've ever done is to come see me. And I've seen first responders and combat guys and physicians, and I've seen a lot of people like that seem to have their shit together. But for some reason they still need help. And so I think I would recommend, one, normalize it. It's normal to struggle with things. And I think it's also normal to seek out therapy. And I would also recommend taking a leap of faith and trying, or taking one step, either making a call or scheduling with someone or having a consult, and just trying it. Because even if you take one step towards facing whatever you need to face, that step is that you're doing something different. And then that step could be starting with a therapist. That step could be just, oh my gosh, that was this craziest thing. I'm never going to do that again. But that step can lead you to the next step, and you'll keep honoring yourself. And then the other thing I would say is to find someone that you feel comfortable with, because there are certain personality is huge, and I tend to do better with people. We all have criteria, right? I tend to like my own doctors and practitioners who are kind and patient, and I'm very gregarious and social and outgoing. So I like when people can kind of match that level of friendliness in their interactions. And so I think, but then I also tend to like people who are firm and who are kind of like, okay, we need to kind of do this. We can't just talk, and chat the whole time. So I think personality is good, and then just trying it and doing an intro session maybe, and just see what happens in your body and see if you feel comfortable with the person. Because I think one of the other things that is the most predictive of successful treatment is the relationship. So feeling comfortable and feeling seen and feeling unconditionally accepted. And if that's not there, then there's not really a good chance that you'll have the support or have the container you need in order to overcome some of those things. And the reason is because in therapy, some of the content that comes up is really vulnerable, and you need a lot of support because it's the first time you're talking about it, or there's themes of guilt and shame or abuse or things that are dark. And I think I told you before that I often hear in my office the phrase, I have never told anyone that before. I've been holding on to this for years. You're the first person I told, or nobody else knows that, and I have so much shame or something. So it's just, and that's just so vulnerable and it's so precious. And so I think it requires just feeling safe and seen and comfortable, and personality is huge. And sometimes there's a click and sometimes there's not. And just go with your gut and your intuition, and ask yourself too, how does your body feel? How safe do you feel with that person? And even doing a body scan when you're in the therapy session or meeting the therapist of what am I noticing? Is there openness? Is there expansion? Am I kind of going into the floor because I'm so nervous, or just kind of figuring out how your body's reacting to that therapist and seeking out stillness and calmness and openness.
Thank you. If people want to contact you, learn more about your services, how would they get in touch?
How they get in touch, so they can visit our website, denverpsychotherapygroup.com. They can send an email to schedule@denverpsychotherapygroup.com, or give us a call. We work with physician referrals as well. So if they're working with a physician, they can have their physician send us a referral. But those are the ways.
Awesome. Hilary, so grateful that you were able to
Thank
make it
you.
out. Yeah,
Thank you for having me. What an honor.
Wonderful to visit with you, and keep us posted.
Thank you. Thank you so much.